welcome to today's workshop. By way of introduction, my name is Sophie Pose, and I am the Director of Strategic Partnerships at the Mayor's Office of Community Mental Health, which many of you may have known formally as Thrive NYC. We are so glad that you are here today to join us for these workshops, which have been developed with our partners service program for older people and Reverend Dr. Wyatt. Thanks to you all for your partnership. So before we dive in, I'll share a little bit of information about our office and why we're so committed to this work. So our office has the goal to reduce barriers to mental health care, to address mental health challenges and illness before they become crises, and to ensure that New Yorkers have the resources they need when they need them. So when we talk about eliminating barriers to mental health support, one of our key strategies for doing so is to collaborate with organizations and individuals like yourselves who maintain deep ties and trust with the communities they serve. And this is one reason that we are excited to work with you to launch and participate in these series of workshops that will really enhance the work you're already doing as faith leaders, to share information about grief and the bereavement process, to complement the work you're doing to counsel the communities that you serve. And so before we dive in, I wanted to share a few data points and some landscape information about grief, loss, and mental health challenges related to the COVID-19 pandemic. I think it's needless to say that the pandemic has had a devastating impact on many communities in New York City. And unfortunately, we also know that the highest share of deaths from COVID-19 was among older adults. 70% of those lost were age 65 and over as of early spring 2020. And across the board, we know that the negative effects of loss on mental health can be severe. Unfortunately, we also know that this has been particularly severe for older adult New Yorkers, 25% of which have reported increased rates of anxiety and depression during the pandemic. And so for older adults who have experienced these losses, I think this is probably, again, needless to say, there are a variety of factors related to the pandemic that have exacerbated the challenges associated with these losses and potential emotional distress. The rapid nature of COVID-19 and the unexpected nature of some of these losses, disconnection from family members and supports like houses of worship, school communities, senior centers, anxiety and guilt related to loss and grief, and the social and political conversations that we've been experiencing around pandemic and the prescription of blame and misplaced blame. So many of these factors have only exacerbated the challenges that we're all experiencing emotionally. And so in this context, our goal for today's session is really to share some information about grief and the grieving process from a mental health perspective. Many of you, I know, are already providing key sources of support and listening ears to your community and doing innovative work to address these challenges. And so today we'll share some more strategies and resources that you can use to bring to the communities that you're working with in Queens and even citywide. So that's our goal and sort of the framing for today's workshop. We're really looking forward to hearing your perspectives as well and to have a two-way dialogue about these issues. And my final plug is to say that we'll be sharing a survey at the end of this workshop, and we really, really hope to hear your feedback so that these offerings can continue to be enriched and deepened and to serve even more faith leaders and communities with this work. So thank you for being here. And without further ado, I'll turn it over to Reverend Dr. Wyatt.
Thank you, Sophie, and thank all of you for doing whatever you had to do with all that's on your plate to put something else on the plate. It is welcomed and appreciated. As you heard, my name is Alfonso Wyatt. I am an elder on the ministerial staff of the Greater Allen Cathedral and founder of Strategic Destiny, Designing Futures Through Faith and Facts. It is an honor, it is a privilege, and it is a calling to be before you at this particular time, helping to move this workshop, this bereavement and loss workshop. as I stated at our first, this is our second in a series of 3. The next one is November 4th, I believe. If you know somebody and if you feel so moved, let us know and we'll make sure they get to that particular stop. I want to take you back for a minute to a time I was doing a men's workshop for a church in Harlem. And I'm talking to maybe about 10 or 12 men. And I've asked a few questions. One of them is, what keeps you up at night, which is a very general question, but oftentimes I can get a lot of information. And one gentleman, he was an elder, probably the oldest person on the call, talked about when he went to the supermarket because his wife was ill, she had to go with him to the supermarket. He would go shopping and leave her in the car. And by the time he finished this story, there was not a dry eye in any of the little Zoom boxes. And I really feel that this particular series is answered prayers, in terms of really dialing into what goes on in people's homes and in people's hearts and in people's minds, and what is lived experience that may not be talked about. I could tell by the reaction of the other gentlemen on the call that none of them were aware of this. So what is going on behind closed doors? I had the opportunity to study at the Ackerman Institute for Family Therapy. And one of the lines that I remember is that you make the covert overt. And through what is designed for you today, we will attempt to do just that in an interactive, supportive way. And with that said, I want to introduce our facilitators extraordinaire for them to come, as we say in their own way, Martine and Carola. I see you get it right first. No, I'm big on that. We'll take it from there. There will be time for questions. You can raise your hand. You can use a reaction hand emoji. You could use the chat. Whatever it takes to make sure that you are heard and that you are fed, we will do. So without further ado, I turn it over to Martine and Carola.
Thank you, Reverend Wyatt, for that wonderful introduction. My name is Martine Barron. I am the owner-operator of MJ Barron Consultant. I am also a social work supervisor at Service Program for Older People, also known as SPOP. I'm also part of the faith community. I am a member of the Abyssinian Baptist Church in Harlem. My pastor is Reverend Dr. Calvin Otis Butts. In the church itself, I am the ministry leader for a social work ministry, which we call the Center for Care and Advocacy, where we provide services to the community and congregants for mental health and behavioral health services. So I'm happy to have this conversation. I think this is a great opportunity for us to begin to talk about grief and loss in the faith-based communities. SPOP is a great organization. I work along with Carola Chase, who will introduce herself now.
Take yourself off mute.
Are you with me, Carola?
Take yourself off mute.
All of that. I was saying thank you, and thank you Reverend Dr. Wyatt for getting my name right. I appreciate it. I'm letting somebody else in. My name is Carola Chase, and I have been with SPOP for over almost 25 years. So I've been working with clients there, and I'm the director of bereavement. So I help run the groups and train volunteers who actually run many of the groups. I also have a private practice with children, adolescents, adults, older adults. So I sort of run the gamut in terms of the people that I work with. So really happy to be here today. And oops. I just want to say briefly that SPOP has been around for about 40 years. And we just aim to help people stay in the community and stay well in the community. And as you see, we were founded in 1972. So we've been around quite a while. And we have a number of services, a clinic, we have a psychiatrist, a nurse practitioner, and we also have the bereavement program, which we'll be sort of talking about in an ongoing way.
So our objective this morning is to help you guys become more familiar with the aspects of grief and loss, that particularly how it affects the older population. We're going to be discussing the elements of the grieving process and provide techniques and strategies on how to work with older adults in helping them cope with loss and grief, how to identify complicated grief. We also are going to provide some strategies for self-care. It's important for us to take care of ourselves as we try to heal others. So these are going to be our objectives for this morning. The impact of COVID. We were all impacted by COVID. None of us expected this pandemic last year. I remember last year sitting in the office when we were told that we would be able to work from home. We were all very excited, thinking that it would be a 1 week or 2 week thing. It ended up being a whole year. Our churches were closed, right? This is the first time in history I can recall that houses of worship were closed. And we had to develop new ways of communication and new ways of worship. Our church particularly is a space of spiritual nourishment, right? Black churches are the own spaces for the congregants to come and find refuge and minister not only to the needs of the soul, but as a place of social life. So I want to pause here now and just turn it over to our participants. If you can state your name, your house of worship, and what the impact of COVID was on your house of worship, please do so now. Reverend Wyatt, can you please assist?
Yes, as soon as I hit that button. So you'll say your name, you'll say your house of worship, and or your vocation. Work is real important. And we'll go from there. And a few of you, because I know a little bit about you, I may just push a little further if I have to. So in order to maximize the time, I'm going to start with Reverend Bridges. And I'm going to maybe take you back to Far Rockaway at the 7-Eleven. That's not Las Vegas. I don't want anybody to think that's what I'm talking about. But we'll go with Christine Bridges and we'll move through there. Go on.
Okay. I'm Christine Bridges. I am I worship and serve at St. Matthew's Community AME Church in Hollis, where the pastor is the Reverend Dr. Andrea M. Hargett. And I'm an associate minister there. I'm an itinerant elder in the AME church. Going back to 7-Eleven, that kind of threw me. If I could, Reverend Wyatt, just start where I am, where my
Please.
Feelings are right now. My vocation is I'm currently serving as a chaplain with the palliative care team and the cancer center at Queens Hospital Center. I'm employed by Mount Sinai and at Queens Hospital Center, New York City Health and Hospitals. So in terms of the older adult and within our church, I've always felt comfortable working with older adults. I'm also a registered nurse, and I had been board certified in gerontological nursing. And so that was where I gravitated. 7-Eleven was a church in Far Rockaway, which was a group of seniors and who were looking for a minister there. And at that time, I was serving at the Greater Allen Cathedral, and Pastor Flake had asked me to be the interim minister there. And what I found it was a good match of working with the elderly. It was I was comfortable. They were comfortable with me. In terms of COVID, if I fast forward, I don't know if I said enough about 7-Eleven.
No, go on.
But in terms of COVID, at St. Matthew's, I think it was mentioned earlier about the disconnect, the isolation, trying to regroup and see what resources we had. And I think our pastor did a phenomenal job of using everyone. You know, not just the worship leaders that were in the church designated, but across generations, everyone participated, including the older adults and the younger members of the church. For me personally, I worked through COVID. I didn't work from home. With palliative care, I had to come into Queens Hospital Center, and for a while, it was lonely. So I experienced it myself. I am an older adult, taking it back from 7-Eleven. Those years have passed, Reverend Wyatt. And now tag, I'm it, as well as providing services. I was lonely. And so the patients that I was called to serve, and even in the church, I felt the loneliness of the hospital was empty. And I felt the isolation. Even just coming to work, there was no one on the streets. And I felt that separation. I couldn't even go to my church, where sometimes I would stop before going home. I lived in Briarwood at the time. I would swing by the church. Well, there was no church to swing by. So that isolation was very real. And so I really feel that this is the bereavement and the loss. I heard the screams of family members as they heard that the loved ones were lost. Many people dropped off family members in the ED, in the emergency department, and never saw them again. I met with people sometimes on the outside because they were trying to get in and they couldn't get in. So I guess it was traumatizing, and that separation was traumatizing. And the response to trauma varies. I mean, there were some people who were over functioning, calling me several times during the day, not believing that the loved one had passed, and some were angry. And there were very few patients at that time who made it early on. As you know, the very few who came in through the ED and either went to ICU or stepped down, they weren't large in numbers. And just the whole PPE, when it became scarce, I was unable to go to ICU like I normally did. So I did a lot of things from my office, and it was with bereavement, with family members. It was with loss. And I'll end there to just give
Thank you.
others.
And thank you for bringing us all into the reality of what is going on. I'm going to go, Jean, is that Jean? Am I looking at the name correctly? Well, I don't know if Jean can hear me. Bernadine.
Jean, unmute yourself, Jean.
I'll come back to Jean.
Yeah.
Bernadine.
Hello, I'm Bernadine Moore. I'm a deacon at Hollis Presbyterian Church. And my pastor is Reverend Dr. And we realized during this COVID pandemic that indeed we are the church. Each of us pulled together to be the church. And we survived it by calling each other, by having Zoom services. We have a prayer line to talk to one another, to help each other through this, because before everything started, we were physically in the building. And then when the building closed, I think we had to reorganize and realize that indeed we are the church, we, the people, each part of the body. And so it has been wonderful for me. That's my experience, because we have pulled together and we have stayed in touch. And in fact, we have even become even more intimate with one another, more vulnerable, and therefore we are able to support each other even more. But it has been a trial.
All right, thank you. I'm going to go down to Deanna.
Diana Bartels, I'm Jean's sister.
How are you?
I'm a member, fine, thank you. Member of an elder at the Hollis Presbyterian Church, and I would just say ditto to everything that Bernadine Moore said. We have come so much more close to each other through online Bible study, through abiding, and through the prayer line and the online worship services. And the good thing is that we have a member in the Barbados who joins us each week in worship, so we can enlarge our circle. We don't have to depend on physically being there. So we haven't opened up yet. We hope to soon, so that we can actually do hybrid services of both online and in person.
Thank you, Elder. Dina, Sister Dina.
Hi, how you doing?
Good.
Yes, I'm a member of a Christian Life Center worldwide in Rex, Georgia, in Atlanta. And I was invited by my brother. He actually lives in New York. He goes to Mount Moriah in Hollis, Queens. And so basically, my church didn't shut down as long as I know you guys in New York. New York, was shut down much longer. My church actually started streaming right away, because we always been streaming, but it was only shut down for maybe about 2 months. So they adapted to the streaming part of it, because they were already, doing it, and it wasn't a struggle. But, even online, even streaming, it wasn't as many people it would have been like that attended church. I think it was a lot of fear, that took place. We didn't know what was happening, and it just, it's still going on. Actually, it's still not, now that the church is open. They spaced the seats apart and everything, but it's still not as many people as it was. I mean, it was overflowing. And I'm here. My brother thought that it was a good fit for me to join you guys, because I just lost my husband 2 months ago to COVID. So I'm trying to figure this stuff out, but I never lost my faith. But I'm hanging in there, and I'm trying to regroup and see where I belong and where, should I move back to New York? I don't know. Some of my family's still in New York, and I have family here too. So.
Well, I'm going to just jump out of the flow just to speak into you, to let you know that this is family, whether you've seen them or not, and we're
Thank
here
you.
for you. And I already know one or two, we're going to follow up. I'm going to put my information in the chat in terms of my email,
Okay.
and I want you to email me. All
Thank
right?
you.
All
Thank
right.
you.
And let me just do this. Everybody just stretch your hand out. Just stretch your hand out. Just stretch your hand out. I want you to send the best vibe, the best spirit that you can to let Sister Hardy know that she is not alone. And that and it is no accident that she's on this call from where she is. All right, we'll let that stay right there. And with that, I'm led
Thank you.
now to go
Thank
to, you're welcome, daughter, to Dr. Carol Dougherty Steptoe.
I knew you were coming for me.
You knew I was.
It's interesting. I'm connected to so many people here. My name is Carol Dougherty, and for the Steptoe, for the last 5 years, I've had the joy of shepherding the church I was raised in at Hollis Presbyterian Church, and I do work with many churches. My ministry is Healing Dialogues Ministries, where we're focused on healing God's mouthpieces. We work with faith leaders. But I've had the joy of, as I said, of being with my church, where I was formed and raised and loved and nurtured. And what they haven't mentioned is that perhaps we're being prepared for COVID, because right when I came back, we lost many pillars in our church. We had so many losses in the church. And so we have been dealing with ongoing grief. And that was primarily, I think, my role was to kind of usher people through grief of not only many of our elders, but also some of our elders losing adult children, even before we even dealt with the pandemic. And so trying to help people go through process of loss when you're going through your own process of loss as well. And then when COVID hit, as many of them talked about, it wound up being a backhanded blessing. But I think that we sometimes forget the fear and panic. And as one of the reverends says, Reverend Bridges talked about the isolation that comes along with that. And so we've learned that we've gotten closer. And as Deacon Bernadine said, we've learned to discover each other in different ways. But there was all of those things: isolation, fear, panic. We lost a long time. Our church secretary died from COVID. We've had some members that have had it. And so it has been a push. We know that God walks with us. I also, Dina, served at Mount Moriah for 20 years. I'm also an itinerant elder in the AME Church. I also served at St. Matthew's for many years, and Reverend Harkett is a dear mentor and friend. So, and Dina, we're having a retreat. If I can get you to New York in 2 weeks, we're going to be doing a lot of stuff on grief. And I was just on the phone with my sister-in-law who lost her husband. And there's a lot of people are in the depths right now. So we have to remember that we have to continually reach out and understanding that people are also dealing with compassion fatigue and all of that. So this is timely, and whatever we can do to keep pushing in, we definitely want to continue to do that.
Thank you, Doc. I'm going to go down to Tonya Wilson. I don't see you, but I see your name, and I do know you. Are you there, Tonya?
Yes, I am here. Good afternoon, Reverend Wyatt. Good afternoon, everyone. Thank you for having this. Can you hear me?
Yeah.
Yes. I just want to say, first and foremost, my sympathy and my condolences to you, Sister Dina, and to the sister of Miss Steptoe, who was just speaking. it's a very difficult thing. So I'm Tonya Lynn Wilson Thomas. I am one of the Veterans Benefits Coordinators over at New York City Department of Veterans Services, where we serve the veteran community here within the 5 boroughs. I'm also a surviving spouse. My husband was in the military. He was in the Marine Corps. So this is important work that I'm doing at the organization, at the agency. I'm also a longtime VA hospital volunteer. And so I actually, for the chaplaincy at the VA hospital, and an aspiring chaplain myself. So it's good to be on the phone and in such company with individuals such as yourself. I also facilitate New York City military caregiver support, survivor support for our military families who lost military veterans or active duty. I facilitated for the city of New York on one Wednesday a month. And we have families sharing so many things, like some of the things I've heard here. It's not easy, but I would love to be in touch with you all, and I look forward to communicating with you. And COVID has done an extreme number on our veteran population here in New York City, well, across the country, but it has made a lot of new military caregivers caring for veterans who were well prior to COVID, but who came down with COVID, and now the whole family dynamic has changed. And it also made many more surviving spouses of our veteran population. So we have to do a lot of work in our community to see to it that we are safe and from this virus, not only safe from the virus, but grief is very isolating, as we just mentioned here. I've been through it myself, some of my colleagues and the people that I engage with. So we have a lot of work to do to make sure that we don't isolate ourselves.
Thank you. I got a couple of more, and then we'll be turning it back. Sister Boone.
Good morning, everyone. I am Valerie Boone, and I am a sitting elder at Hollis Presbyterian Church, the church where love grows, because we lift up the name of Jesus, our motto. Along with Bernadine, Diana, Reverend Carol, Patricia, we are in a congregation that probably 75% of our members are over 75. So though we didn't directly lose a member of our congregation present to COVID, we have been severely impacted emotionally, I believe. But one of the wonderful things that our ladies have mentioned before, we have done, I think, a yeoman's job at reaching out to our seniors. We call, we do cards, we, email, we've done drive-by visits, which was like a wonderful thing. Many of our seniors were so happy just to come to the front door and see us drive by with our hello signs and waving and saying, how are you doing? And we have done a reach out to try to educate our seniors who were not tech savvy. So we have many seniors in their 80s and 90s that have learned to use pads and laptops and Zoom. And, it's just amazing to see our 90-year-olds who just come on Zoom and are right there with us. So it has been a learning experience for them, but also for us, because we have reached out to them to keep them connected as we continue to do. Pat and Bernadine, well, Pat didn't speak, but Bernadine, I believe, is a retired healthcare provider, nurse, and like Diana and I, we're retired scientists. And so we also participate with the Katz Institute for Medical Research out at Northwell Health. And that is an excellent resource. It brings healthcare information and information about health equity, whether it's health, mental health, or all around, that we're able to share with our congregation. And so that's been wonderful partnering with them. And so, Sister Dina, I am happy that you're here with us. And, you know, when life gives you lemons, you make lemonade. And not to minimize your grief, but I'm happy you're here to be able to share in the information. And thank you,
Thank you.
Reverend Wyatt. Thank you, Reverend Wyatt, for being able to share this with us.
Well, no, this is a calling. I'm going to go to the next two people, and we're going to then, well, three, and we'll go from there. Corinne Powell. Did I do Corinne? No?
Corrine.
Corinne?
Mm-hmm.
I have a cousin named Corinne. Corinne, I'm sorry.
Hello, good morning. I'm sorry that I came on late, and excuse me for my voice. I'm not feeling well. But I'm a good friend of Reverend Carol Darby of Steptoe, and she has asked me to, join. Also, I am a member of the Queensboro Seventh-day Adventist Church in Queens Village, and I wanted to, be part of this platform. Also, because the loss of my son, it wasn't due to COVID, but due to another reason.
Mm-hmm.
And I just wanted to be able to, get some insight on how to cope with bereavement and things like that.
Okay, so we'll be right with you. And the same as we said to Sister Dina, we say to you, we're all family and we're all here. Sister Wilson.
Shirley Wilson, you're referring to?
Yes, I'm sorry, Shirley Wilson.
Yes. Good morning, everyone, and Dr. Wyatt. I am Associate Minister at St. Mark AME Church, Reverend Kimberly L. Dethridge, pastor. It's just a pleasure for me to come on today. And our church, we have met a lot of challenges. We have lost quite a few members through COVID, as well as other illnesses, and it has been challenging. And as one person has stated, we, the people, are the church. So we have come together, and we we had to close, our church closed, and we started a worship service via phone conference. And then we moved to virtual onto Zoom. We have been able to continue communicating with our members through the prayer line, the Bible study. Our pantry is open, was open the whole duration of the COVID experience. We were open and providing food for the whole community. I am a new minister with the grief ministry, and we have been meeting and having workshops, and Reverend Bridges is one of our speakers. Thank God, she was very good and encouraging. And we meet once a month so we can just express things that's going on in the church and to have a safe platform. And I'm here today so I can get more knowledge of the grieving process and reach out to other groups that I can be invited to and invite to. So thank you very much.
And thank you. And your pastor was on Tuesday. So now we have you. And yes, Tonya, I didn't know there were two Wilsons right next door to each other. Is also a member of the Greater Allen Cathedral. Okay.
Dr. Wyatt.
Yes, ma'am.
Dr. Wyatt, can I just say my deepest sympathy to Sister Dina and my condolences, and may God continue to surround her with his love and compassion for this time and her bereavement. And like you said, we are family.
All right. And I think last but not least, Sister Garvey.
Good morning to everyone. My name is Patricia Garvey. I'm a member of Alice Presbyterian Church, and my pastor is Reverend Dr. And as we come with grief, it doesn't matter how long or how short grief. I lost my mom a few months before, I believe 3 months before COVID hit. And sometimes you still feel that loss, that emptiness, but we move on. And with COVID, for us, for me, it's a big loss because I miss the fellowship of my sisters and brothers and in the temple, in the church on Sundays. We also have a food pantry that we volunteer, and that closed down too, and we don't know if that will be open again. So that's another loss. But on the flip side of everything, we had some outdoor service, which was very nice. And I learned to use the computer to Zoom. I'm on more Zoom now than I could even imagine. And I'm learning as I go on from day to day. And out of this, I learned so much. And we have a prayer line from Monday to Saturday. It's a blessing. I'm telling you, it is empowering. We can let go and relax and talk to each other without fear or doubt or criticism. And it is wonderful. And we welcome anyone who wants to join us, because some things that I held on for so long, I could release it to my brothers and sisters and feel comfortable. So with this COVID, it's have its downside, which I learned out of it, and I'm continue to learn it. And I thank God for this format that we can come together and express our grief.
Well, thank you so much. And I believe that you were the person that offers a nice segue to our speakers. And you touched on some of the issues that they will go a little deeper. So with that said, I'm going back to you, Martine.
Thank you.
You have the helm. So take it.
Thank you, thank you. I would like to just thank all of you for sharing those stories. I think it's very important, again, that we just lift up how resilient we are despite a very difficult situation. The church was able to still stay connected. I heard people say prayer lines, online worship, food pantries. And that's just fantastic to see that we were still able to stay connected. Let's go to the next slide.
And very moving stories. I was very moved to hear so many different backgrounds and ways that you've reached out to the communities.
Yes. Yes. And we'd like to just take 30 seconds, right? Sister Hardy, again, our deepest condolences to you for your loss. And all of us know somebody who knows someone or experienced a loss ourselves. So let's just take the next 30 seconds in silence to acknowledge those who have lost, either to COVID or otherwise. Thank you, all of you, for taking that time. Life during COVID was very difficult.
Sister Martine, 1 second. I was
Yes.
made aware that I didn't go back to Jean, and
okay.
And now she's walking away. I'm gonna suffice it to say, Carol, if it's okay, I'm just gonna move on. Go back,
okay.
Martine.
It's okay.
Okay. So life during COVID was very difficult, specifically for older adults and people of color in lower socioeconomic groups. When I was looking at some of the data, right, some of the zip codes that were hardest hit were in Queens, Corona, and East Elmhurst in particularly. And we have, you know, those are the areas where people were testing positive and losing loved ones frequently. So we want to talk a little bit about how to deal with that loss, how to, you know, support those who are losing people. I think Chaplain Bridges was talking about how isolating it was and how a lot of times that those who lost loved ones dropped them off in an emergency room and were never to see them again. And that was very disheartening and supportive. So I'm going to turn this over to Carola, who will go into the different types of loss and grieving processes. Carola?
Yes. I'm going to start with anticipatory loss, which, as this is self-explanatory, it's a loss that you expect to happen. It hasn't happened yet. So it can happen with a chronic illness. It can happen with a life-threatening illness. It can happen with dementia. The people who love that person are waiting and know that this person is going to die and is trying to prepare. And it can be a really, really painful period to know that you're going to lose someone and you have to wait. And it feels like the person is gone and yet they're still there. So I find this a very difficult thing. We just got a call from somebody last week who was looking for a bereavement group for his wife is in hospice. Unfortunately, we don't have groups for people whose spouse or partner or other people have not yet died, but I was able to refer him to some place that was appropriate. I know this is not quite in order, but ambiguous, I think, really fits with, it's sort of connected to anticipatory, but also fits with COVID deaths. It's a loss that is not complete. Like someone has disappeared, a body is not found. It's someone who's lost, but something about their situation is unknown. It's maybe somebody with a mental illness, with dementia, someone who's in a coma, somebody who's missing in action, can't be found. They're sort of gone, but it isn't quite clear. All these losses are very, very painful, obviously. Disenfranchised loss is for someone who feels in some way not entitled to mourn. They may be mourning, but they don't feel quite a part of the grieving process. So it's a loss that isn't recognized or valued. An example of disenfranchised loss might be a former spouse who dies. Maybe the spouse had remarried, there are other children. So even when the ex-spouse dies, the person isn't told about the death, isn't included in the grieving process or the funeral service. And this is very hard to deal with, to find an appropriate way to grieve. We've had a number of people in this situation who have been part of our group, so I've seen how painful and wrenching it is. A symbolic loss is more intangible. It's more like a psychological loss, a spiritual loss, a loss of attachment. So it might be, for example, a loss of hope, a loss of dreams, a loss of faith. I think one of the people who spoke said that all the congregants in the church did not lose faith, remained very, very connected. But sometimes it happens when there are really difficult losses that people say, you know, what do I do about my faith? I can't believe anymore. It can happen with a divorce or a breakup, or even losing like a sense of a role model that one had, or an authority figure. So very different experience. And traumatic loss, we all know what trauma is, and I think one of the people here spoke about doing a lot of trauma work. So trauma can be a wide range of losses. A loss of a child to a parent is traumatic. A loss from 9/11, a loss from the Holocaust, a loss to COVID when we were separated from people who were in the hospital, couldn't say goodbye, couldn't see them. Some kind of a freak accident. I think with gang violence, with institutional racism, loss with violence in the community. And I think specifically of one person in one of our groups who was walking with her husband, and there was a car that came right at them. It was going to hit her. The husband stepped in front of her and the car hit and killed him. And it was in the newspaper. So she sort of came to the group saying, you know, her experience seemed like just utterly traumatic. She could not get past just that last experience with her husband. And an unattended loss is a loss that's never fully grieved. I think with this, I always think of children losing a parent where they really don't have the tools or the capacity to fully grieve, and where children sort of move on with their lives and look to other people as though they're not grieving. And yet they are, it's just underground, and it stays at that same level, kind of like a rumbling forever. And you see these same people, you know, in their mid-60s, and the slightest little thing sets off those grieving reactions, usually separated from the actual loss. So somebody might watch a movie and the music or something about the story emotionally reminds them of that loss, and they begin weeping. And they may say, like, I don't know why, it's just sad, but it's usually connected with that original loss. So you may see, with unattended loss, you may see other symptoms. You may see behavioral manifestations, such as sleep problems, loss of appetite, irritability. And as I mentioned, sometimes you see crying, but sort of unconnected to the actual loss, crying over other things. I want to, since we were sort of throwing these words around, I thought it would be good to actually define them. Bereavement, which we talk about, I think we talk about sort of in the field, we talk about it. It's the period of grief and mourning after a loss or death. And it's not something that generally people use. And, you know, people don't say I'm bereaved. They tend to talk about grief and mourning. So grief is an internal manifestation following a loss. So let's say a manifestation, an emotional manifestation of grief would be anxiety, guilt about the death, fear of other things happening, sadness, anger, resentment, all kinds of feelings, even relief sometimes, particularly if you've been watching somebody suffer, there can be relief that the person is gone and relieved of their own pain and suffering. Mourning is more an external display of grief. And somebody described it as grief gone public. So it's not that internal, what the person is feeling, but whether they're weeping, whether they're snapping at people and irritable, whatever manifestation externally. Martine?
There I go. Thank you for that, Carola. So grief shows up differently. During one of our last trainings, one of the participants talked about leaving her pastoralship and noticing that two particular members of the church really started bickering with each other. And She then realized that they were grieving the loss of her leaving the position. So grief shows up differently for different people. Carola just went through the bereavement, grief, and mourning process. And sometimes people who don't mourn outwardly mourn inwardly. And these are the people that are in our congregations that we have to try to identify and see how we can continue to support them and allow them to grieve the loved one or whatever the loss is for them in an open, healthy way. Grief shows up differently, right? Different factors, different personalities express themselves differently. So as we move forward in looking at grief and loss, how do we identify those in our congregations, those in our communities who need support from us? Next slide.
And Reverend Dr. Wyatt, I just want you to know that we changed some of the slides just so that you wouldn't get too bored from having seen them again. So Martine, this is great. This is great.
Yes, because I wanted to talk about grief being a journey, right? There's no timetable for when someone would get over a loss, right? Sometimes it's a journey, it's a process, and we go up and down. Carola,
yeah,
can you talk more about it?
Yeah, it's like highly individual. I talk to sometimes people call about our program and they say, you know, when am I going to stop feeling this way? It's just too painful. How long is this going to go on? And I have to say again and again, I don't know. I don't know that you will feel better. It can take a very long time and everybody is different, highly, highly individual. And I wish I had an answer. I don't. So sometimes what happens is that earlier losses resonate and are re-experienced. So if you had somebody really important that died 10 years ago and then you have a loss, you re-experience former losses, which can make it even more difficult and painful and wrenching. I don't know if a lot of you, they used to talk about Kubler-Ross's stages of grief. It was denial, bargaining,
anger,
bargaining, another D.
Denial
And acceptance, right. Denial, I thought was the first word. Anyway, DABDA. Mm-hmm. And I think that's been a little bit discredited. The idea that you go neatly from stage to stage to stage. And once you've reached acceptance, you've just accepted the death. And I don't think it works that way. I think of Joan Didion, who wrote a book after her husband very suddenly died. And it was called The Year of Magical Thinking, where she knew he had died. I mean, she was a sane person. She knew he had died. And yet she didn't want to give his clothes away just in case he came back. So on some level, she had seemed to accept it. And another, she didn't want to move to another apartment. What would happen if he returned? So those two kind of contradictory ways of looking at it. I think of it more as this sort of 10 steps forward and 20 steps back. And I gave an example the other day of the children's game Mother May I, where the leader will say, Martine, take 20 giant steps forward. And then the next time you come up, they go like, I'm sorry, 300, umbrella steps backward or something. But I think that's the way it is. It's a complex, dynamic state with a range of emotions, thoughts, feelings, memories, behaviors, and spiritual components. I often talk to the volunteers who run our programs, and one of them will say, Mrs. Smith in the group, she's not even crying. I don't understand it. She doesn't seem to be grieving. And I explain again and again, I know she's grieving because I've talked to her and I know she's going through a really hard time. She doesn't do it that way. Public crying, she's not comfortable with. And they may come and say, like, it's been 6 group meetings and, Mr. O'Connor doesn't stop crying. He's still weeping every time. Again, that's how Mr. O'Connor grieves, that everybody's different, so that we have to kind of get our own expectations out and just listen to what people are going through. And the bottom line is there is no blueprint, there's no manual. It's just a really painful, long experience. I'm sure a lot of you have heard about, see, Dr. Wyatt, we changed this one too for you. Just for you. People hear about complicated grief. So what is complicated grief? It's basically a grief that doesn't seem to be progressing. It doesn't seem to be moving in any direction. It's lingering, it's ongoing, it's unrelenting. We had somebody in our group who, she went through several series of the groups. She connected with all the people after the group, and she could not give up where she was in terms of the loss of her husband. And it went on for several years. We tried to refer her for treatment. It was excruciating. It was excruciating for people to see her and in the same pain a number of years after her husband had died, like just no change. So the first type of grief is chronic grief, which is, as the expression says, long duration and intensity. It doesn't go away. I think that a parent who has lost a child, I mean, there may be some progress, but it's chronic. You're 10 years after that child has died, that parent is going to be still grieving. Loss from any kind of genocide, from any kind of violence. I've heard of people who had a loved one who was suddenly murdered unexpectedly. I think that's another one, that the pain and the trauma is chronic. Often like intergeneration. I don't know if you all hear about like intergenerational trauma. But that's something that I think is very prevalent, like from the Holocaust, even from slavery, from generations after. I see somebody nodding. So delayed grief is grieving that has been somehow delayed or inhibited. So the person loses somebody, even somebody that they love dearly, and they don't seem to be grieving. They know something's wrong, but they somehow say, I can't cry. I don't understand it. I just can't cry. So an example of this was a woman who came to one of the groups. It was 4 years after her husband had died. And she said they had a wonderful marriage. She missed him terribly. She had not really grieved. And what happened was that 4 years after he died, she retired. She was 84. She retired at 84. And somehow she didn't have this chaotic, busy life. She didn't have something to sort of keep her going from day to day. And that's when she began to really grieve for her husband. Masked grief is a grief that someone doesn't recognize. Other people may say the person is suffering. The person is showing signs of grief, but they're not actively grieving. There may be anxiety, there may be substance abuse, there may be physical symptoms, medical problems, but somehow the connection with the loss is missing. So you have like the symptoms over here, and then they talk about the person, the person died, they could talk about it. And again, I see this very commonly with people who lost a parent in childhood. And we did like a workshop recently in which a woman spoke about having lost her father at age 6. And she was able to talk about it, he died and this is what happened, but without particular grieving. But she said that when she worked with clients, who had lost, let's say, a 89-year-old parent, that she felt some kind of resentment build up in her, that she said it was hard for her because she kept thinking, you had your parent till they were 89 and I lost my father at 6. That's a sort of a mask thing, and that they were separated. So again, I think a good example of masked is a child who loses a parent, can't really grieve, has no tools to grieve. They don't know how to do it, and frequently losing a parent as a child, it's embarrassing. I mean, it may sound ridiculous to us, but like other children have their parents. I don't want people to know that I've lost my parent. It makes me stand out. Children don't want to stand out, so they push it away, and sometimes it just comes bubbling up in other, unexpected ways.
Thank you, Carola. I love this slide. It's, I am death. And the person says, that's okay, I will speak louder. So humor is good to help people break that feeling of sadness. So telling jokes and being in a place of humor is a good way to break the discomfort of someone who is grieving, right? Studies have shown that humor and laughter help people live longer, happier lives, and can be very creative and help people remove the discomfort of having to discuss loss of a loved one. I have a client who recently lost her husband as well. And she feels guilty every time someone talks about her husband, and she starts crying. And I tell her that it's fine. I said, after you start crying, if you're beginning to feel guilty, then make a joke, right? Break up that seriousness and uncomfort that you feel with laughter, because laughter heals. And we are in a healing process. And again, mourning is not linear, right? And humor can help break that feeling of uncomfort and tension when you don't know what to say to someone. Next slide. So this brings us to mental health and the faith-based community. So I'm going to ask now, we're going to pause now. And again, this is an interactive workshop. I want to know how your church or your home of worship, talks about mental health, if they do talk about mental health. What we want to do here is to begin to normalize behavioral health services, normalize congregants to seek professional help when they feel that they are in need of comfort, when they are in need of more than just prayer. I'm a believer. Prayer works. But we also know that prayer and being prayed for can coexist with receiving mental health treatment and even in some severe cases, medication. So Reverend Wyatt, can you help me talk to the participants, just 1 or 2 words about how mental health is perceived in your house of worship?
Right. And because we're moving, we're like 3/4 done, I'm going to just kind of push the pace. So if you can respond to the question as cogently as possible, that way we can get a maximum number of views out. Okay. That's
right, pithy.
Piffy. That's right. Look at you. Look at you. You got lost in that labyrinth, I see. Okay, let's start it off. Let's start it off.
I'm just saying real quick. Go ahead.
Go on.
No, that's what I was gonna say. Just how do you practice that?
So we had put together a group of retired social workers and medical professionals called Care Path, and while we had it going, it was extraordinarily helpful 3 out of the 6 people died, though, in the process, but it did help us to begin to, they were the team that I went to if we had mental health issues that come up, and it's something that I realize is essential that we need to try to reestablish again. But that was one of the ways that we began to open up the discussion about it.
Excellent. We did the same thing at Abyssinian. Again, I'm the ministry leader for the Center of Care and Advocacy, and we have active social workers as well as retired social workers there. And we provide brief counseling and referral services. And we're really connected to community-based mental health organizations. But we'll talk a little bit about that more. I would like to hear from some others.
I'd like to just share that the AME Church has a health commission, an international health commission, and they have had mental health programs. I think there's a sharing because of the connectional church of resources, and in our announcements at St. Matthew's, it's oftentimes whatever's going on in the community, just getting it out there, talking about, just saying the word mental health. Those words, sometimes people need to hear it's okay.
Okay, doing good. Somebody else? Valerie, take yourself off mute. There you go.
Yes. I just kind of want to, I guess, ask a question, or
please
kind of say what I see somewhat in our congregation, I guess, are 2 veins. There have been populations of people that say, look, I don't want to talk about it. I'm ready to move on. And they just kind of shut down, kind of just say, you know what? I know I love my husband. He died, but, I don't want to talk about it. I don't want to share it. I don't want to be part of any group. I just want to move on. And then we have people who are, which is a whole nother vein on the mental health side, who are caregivers whose persons they're caring for are alive, but to them, they've died because they're not who they used to know. Mm-hmm. And so they can't even relate to them on the same level as being present in their life. And that I see is very difficult to, kind of know how to work with. And that's not bereavement, but it is a mental health something, because it raises havoc in the family. Because that person that's your husband that you could communicate and talk to and enjoy, now you can't even, first of all, they might run away, or you can't even talk to them about, they don't know what a banana is or anything. And so they're dead to you as the person you knew, although they are still alive.
Okay, okay, you got it. Martine, Carola?
That's like the anticipatory grief.
Loss.
And yeah, but also anticipatory grief, where you're grieving for somebody already who's still present, and it makes it very, very, very complicated. There are excellent groups around the city for caregivers. And I would say, like, find other people, like the Alzheimer's Association has groups for people, because it's impossible. The person isn't there. You feel like the person is there and you feed them and you take care of them, and yet they have no connection with the person that you knew and loved. And it's very painful. It's not even, anticipatory, it's an anticipatory loss, but it's a very current actual grieving process. And sometimes the grieving is over. You feel like you've lost the person. I know somebody whose father was dying, was in a coma, and was basically brain dead. And a friend of this woman said, he's dead. And the person said, like, no, that's the thing. He's not dead. He's there. He's in the hospital. And you're dealing with both things at the same time. Really painful.
Yes. That's absolutely correct. And the feelings and the emotions are the same, right?
So the caregiver groups are just excellent.
Yes, yes. Let's go to the next slide. As we begin to bridge this mental health issues with grief issues, help identify congregants who may be experiencing some form of complicated grief, right? And what we can do is begin to create safe spaces for healing. I know that Reverend Dr. was saying that she has a space for healing in her congregation, right? And opening up the space to let people know it's a safe place for them to grieve, for them to talk about difficulty, about accepting the grief, right? The loneliness, the depression, the isolation that they're feeling, and about creating those safe spaces and working with older adults who be feeling the same without the loss of their activity, the loss of doing things the way they used to independently, right? That's huge for the older population. Creating groups and facilitation for the bereaved where they can feel they have a safe space to go to and get spiritual guidance as well as professional mental health. So creating those spaces are very important. Next slide.
I just wanted to add, I forget who it was who said, sometimes people say, I don't need it, I'm fine, I understand it. Sometimes people don't want it. And sometimes, you say to somebody, how is that working for you? I mean, you're saying that, and yet every time I see you, you seem really sad, you seem depressed, you're crying. Maybe, you can sort of show them what you're seeing. That might be a way of getting some people who are like, no, I don't need it, I'm fine. And you say, like, you're not quite fine.
So how can we support congregants dealing with grief, right? So we talked about creating spaces for healing, right? Now, this can happen within your own congregation or partnering with other congregations. If you're coming from a small church and a larger church is having some bereavement group, I'm just going to ask everyone to put yourselves on mute, please, as we continue the presentation. So creating those spaces and collaborating with larger congregations, connecting with community-based mental health organizations that can really provide that next level of support for your congregants is important, right? Or you could do a setup as ministers and chaplains and pastors. You could set up that one-to-one with the person who's grieving, right? And helping them support themselves through this process, right? By offering information about community, offering information about grief, offering the support to allow them to make those other connections. And also doing wellness checks. I know that, some of the churches were actually doing phone trees by calling their congregants when the church was closed down and checking in to see how they were doing, right? Making sure that they were okay. I know someone here today said that their church was actually doing drive-bys, which is a fabulous idea, right? Oh, Ms. Boone, that was a great idea, right? Checking in, just to know that someone is checking in on you, right? Can help your self-esteem, can help break that feeling of isolation. So I applaud you in doing that.
I love that. You were just like driving by and like honking and.
Yes.
We made gigantic, colorful signs and balloons.
Nice.
And we decorated. We miss you. We love you. Are you okay? And we did a whole
caravan. We made a caravan of about 12 cars.
Oh my God.
And we all descended on the person's house.
Yeah, it was like a caravan, and then we parked and we all got out and we went in front of their house. And
perfect.
They came out, they came to the door and they were like, oh.
Yeah, that was wonderful, because I can imagine, right, the person that's feeling isolated, and there's this caravan of people from their church community coming to say, hey, we're thinking about you.
We're still here.
Right. We're still here. We love you. We may not be in physical proximity, but we're thinking about you. So those type of things are important in terms of creating strategies to promote mental health, right? And the first place in the houses of worship we should go to is on the pulpit. So those who are pastoring, those who are preaching, I want you to talk about mental health support on the pulpit, normalizing it, right? As we go through the Bible, there were several preachers, prophets, and people who were suffering from mental health, right? And Jesus came to heal, right? And let's talk about that healing and ways to heal. My pastor always liked to say, oh, everyone, we can pray, but always get a checkup from your neck up to make sure everything is functioning properly, right? Prayer helps, but so God also gives us people in the community to connect with and to heal each other. So from the pulpit, we should start normalizing mental health, destigmatizing it. You know, I know people of color don't like going to help. They don't like to go see a therapist. They don't like to go see a psychiatrist. They don't want to take any medication, but you need it. Right? Sometimes in some cases you need it, and normalizing that, right? And not running away from it, but embracing different ways and forms of healing is important.
I mean, what if like Jonah had a therapist? I mean, I've been in the whale. I've been just sitting in the middle of this whale. I'm very anxious. I feel traumatized. Please help me.
Right. And Elijah, who was suicidal,
I
right?
mean,
He sat under the tree and wanted to die. Right? Those are stories we can just pick from the Bible to talk about that, right? About those whose children were dying, right? The widower whose son was dying. These are things we need to talk about from a mental health lens from the pulpit and begin to normalize it. In addition to creating, right, supports like the social work groups, the psychologists, go into within your own congregation. You have professionals there, right? Even if they are not the professional, they work in those areas and can help connect, make it normal within the congregation.
One thing, can I just add something?
Absolutely.
One thing that was good, thank you. One thing that was good to be a part of and to participate in from the standpoint of what you're saying is watching all the churches in the New York City area, particularly Queens, because that's where I was, take part in the Weekend of Faith and really push. And that was the time when you speak about the pulpit, the pastors really did open up their pulpit to, or their platform to really allow someone from the mental health industry, and myself included. I participated and spoke to churches, and that was really good to watch the marriage of faith and needing mental health, but to act on your faith, but to also activate in the world we're living in, engaging with each other to just really dig in on what resources are available. And Allen did that. Greater Allen Cathedral did that. And it was a wonderful experience.
Well, that's fantastic. That's fantastic. And I think that we should continue doing it. This should be a practice moving forward, right? Not something we do one time, but ongoing, connecting with the mental health programs in your community. Right? When we talk about developing supports within the church, once we are reaching a level where we say, you know what, this person needs more professionalized individual services, let me call this agency down the block and talk to the director and refer that person. Building those relationships with the community-based mental health organizations located within your community. At the end of this presentation, we also have developed a resource guide, right, that we're going to share with all the participants, listing community-based organizations within your area, right? And I want those church members, right, pastors and preachers, to begin to develop relationships with those community-based organizations, right? Let your congregants know that you have a relationship with them. It's okay to go there. It's okay to speak to someone outside of your household, right, about what you're experiencing, what internally. Does that make sense?
Yes.
Absolutely.
Okay. Okay, good. So,
Perfect sense. Perfect sense. Go on, keep going.
thank you. So we talked, somebody mentioned compassion, compassion. I'm sorry, I lost my train of thought right there. Compassion fatigue.
Right?
Yes. So yes, that's very important. And self-care for providers is also important. As you're dealing with congregants and going through all of the suffering and hearing these stories all of the time, all day, every day, it can become very, very heavy. We have to learn how to unload this, right? So we don't suffer from compassion fatigue, right? So what do you need to do as a provider of care, as an ambassador of healing, right? Is take a temperature check within yourself, right? Find out, am I okay? Is this too much for me? Should I be saying no right now? Right? And develop a self-care routine. What do you do for yourself, right? For your self-healing, right? For you to get back into center after extending yourself all day, right? And it's important to know when to say no. I know a lot of us in ministry work never like to say no, right? We're doing this, we're doing that, we're doing this. And it's important for us to recenter ourselves, right? And take a temperature check. How am I feeling today, right? Do I need help today, right? Do I need to extend myself? Maybe I should just go for a run today or go for a walk today, right? And sit down and eat a meal with my family today, right? Those are the things we'd like for you to do as providers of care. Be the example that you want to see. Next slide. That's it. Now we're opening up the floor for questions, feedback, responses, and how can you carry this and move forward?
I'm going to stop the share now. So we can all be together.
Well, I'm glad you did that. So now what we're going to do, and we're going to move with alacrity. We're coming up, I can't believe that in 20 some odd minutes, we'll be right up to the time that we're stopped. So if you got a question, a comment, thought, or feeling, remember thoughts or feelings may not come back with a response, but you can just get it out. But if you do have a question, just put it out there and we'll keep it moving and we'll keep as many as we can, okay? So you can raise your hand, take yourself off mute one at a time, or there you go. Sister Diana.
Yes, thank you. I'm very concerned about, we have a number of people in our congregation who are caregivers professionally. In other words, they are at people's homes, the people are aging or they're dying, and how they take care of themselves is so important, because I just remember this one particular person when my mother died 20 years ago that actually was in our house 16 hours a day. And she didn't want to leave. And I said, there are times when God sends angels when you need them. And it's in the form of, like Pat, the work that Pat does, and Bernadette. And there are many people in our church that are caregivers.
Mm-hmm.
And they feel loss over and over and over again as they.
Okay, so let me stop you right there.
Okay.
Because no, you gave us the frame, so that's what we need. How do we help people, and especially helpers, who sometimes even feel guilty when they're not helping others, that they're slackers or something's wrong, or if they do have a down moment, they go out and look for people to rescue. So I'm not saying that was the case for the person. It just means that people who are suffering from vicarious trauma sometimes don't even know that that's what it is, or they work it off by working. So let me shift it back up to my two sages for a response.
But I think, again, caregivers are a unique breed of people, right? And ways we can support caregivers, for example, is having them come in and acknowledging their work, right? And having them stop caregiving, right? And just focus on how to take care of themselves, right? And help them look inward to self-care.
Okay.
Self-care and self-compassion for yourself is important. And a lot of caregivers suffer from lack of self-compassion. Go ahead, Carola, you wanted to say something?
No, I think someone was raising her hand, Jean.
Yeah,
Okay.
Jean, I got it.
Thank you. I understand you were speaking to me later before, but I didn't hear you. My friend lost her husband, and she lives in an apartment in Manhattan. And this is a woman I've known since elementary school. Her husband died. I don't know that she's accepted it, but the thing that troubles me is she blamed the healthcare workers for bringing the COVID into the house.
Okay.
Now,
Yeah, it seems like very, like when somebody dies that you love, you want to, somebody has to be responsible, right? So you want to try to find it's this person, it's that person, it was the doctor, it was the caregiver. Instead of actually dealing with the grief.
I'm not, I'm not saying, I haven't spoken to her recently, but I think it's rather unfair to put a blame on a caregiver.
Yeah.
When they were just doing their job.
When they were doing their job.
Right.
Thank you. Thank you, Jean. Anybody else? Question?
I was just going to say again that I think for caregivers, to say to caregivers, you're doing a lot of work, you're doing really hard work. It's also really stressful. It's a lot of stress on you. And when caregivers get together and one of them says, oh my God, at the end of the day, I'm so angry or I'm irritable or I don't want to talk to anybody, they share stories and they don't feel so alone with what they're going through.
We're all going through. Dina?
Okay, well, before my husband passed, I would say 2017, he started losing the feeling in his hands and his feet. So he started falling. He found out he had an autoimmune disease, a rare autoimmune disease. So I was a caregiver since that period, so actually, and I started I felt like I lost who I was, because now everything changed, and now I had to, he started recovering over time, but I had to cook more and different diet that we couldn't go out as much. I had to push him in a wheelchair, and it was different things that were taking place, and I felt guilty for not doing more, and then he became better. Like before COVID, he got his strength back. He started walking without a walker, without a cane at one point, and but it's rough. It was rough. So it was, I never thought that he would pass, but I thought it would get better, actually. I didn't think anything would kind of take him out this way. But it's rough, on the caregiver. The caregiver actually, I think, actually loses, that sense of, it's hard to even put it into words. I can't even explain.
I got you.
Oh, it's exhausting, and it's 24/7. It doesn't stop. Yeah.
So Dina, I would ask, so how do you think the church could have helped you in that process since 2017?
Well, my husband didn't go to that church, but for me, he did come every now and then. They did know him. I don't really think they were a big help. I think that it's because it's a large congregation. I think it was, even through like the death part, I told him that he passed. I don't think that, I felt like they weren't really there for me, I think they could have done more. They could have checked on me. When I mentioned that he did pass at that time, I think they could have checked, even when they knew he was in a wheelchair. Even though he wasn't a member of that church, he had his own church because his mom ran a church, and I kind of wasn't a part of. I was for a minute, but I kind of found my own church nearby where we live. But I think they could have done more, and I don't know how they could have done it, but I think they could have done more for me as a member,
Okay.
Part of the reason, can I just add one little thing?
Let me just hold you right there, Tonya, because only because we're running out of time. But what this tells me is that we need a forum, and it doesn't have to come through the Mayor's Office for Community Mental Health. We need to have a forum where we could dive deeper into these issues. And one thing about life is that there is no rewind button. And once it's out there, whatever, however, whenever. When I pray at church, I always pray for caregivers because they're out of sight and oftentimes out of mind. And I may say to the mayor's office, you may want to think about doing something for caregivers in that regard. So I'm going to move us on, and I'm going to,
I will share a link to a webinar about caregivers and mental health in just a moment.
Fantastic.
One thing that I know about Sophie, and I've been working with her for a couple of years now, is that she and her organization is a repository for information. I see your hand, Bernadine. I'm a teacher. I see your hand.
And Tonya has.
And I always say what you pray for, your tax dollars probably already paid for. And we want to make sure that as we are praying, we're also seeking and finding out the resources that could be helpful. You now have in your chat box a webinar for vicarious trauma, something to look at. Bernadette, is it a question?
It's a quick comment.
Go.
It's a quick comment. As a caregiver of my mom and my brother, I really had to learn to ask for help, to say, I am tired, I am angry, I am resentful. And I was so thankful that I had people from my church who understood that, and my neighbors and my family who came in to give me a day off and didn't tell me, well, you're Christian and you're losing faith. Because I was to the point that I was so angry that I said, if you tell me that my mom and my brother are in a good place, I will scream. Please don't tell me that at this very moment. So I learned that, and we still need to know more how to talk to each other as members of the Christian body when a person is in trauma at that time.
Thank you so much. And I agree with you in terms of, please don't make things up to say that maybe make you feel better. I'm praying for you. If I wrote a book about what to say to a person in grief, it would be that one line, I'm praying for you.
Mm-hmm. I have a question for the group. How many here, I'm talking about church leadership, are connected or know of the community-based mental health programs within their community, within the church, proximity of the church? Tonya, I see your hand is up. Anybody else?
Well, that's a few, but we could do more. We need more information.
Yeah. So that's what I would like to charge you with today, right? Is that Carol and I went through the whole bereavement process and grief and talked about loss, but this is just a snippet of what needs to be done. The next steps for you are to do that, to begin to destigmatize mental health in your congregations. We talked about, creating safe spaces. We talked about talking about it from the pulpit. The next step is to actually go out into the community and form relationships with those mental health organizations within your proximity. Find out what kind of services they offer, right? Find out who is actually in those spaces. And any questions that you may have, make a meeting with the directors and the leadership in those programs to talk about ways you can collaborate, ways you can refer people, and how to support each other. These are the things that we need to do moving forward to destigmatize mental health and behavioral services. Actually offer them to come in and do a presentation at your church spaces, right? Via Zoom like we're doing now. Again, after this presentation, we're going to be sending you some resources and some information in a booklet. But the charge is to continue. This is just the first step in an ongoing process.
And
also go ahead.
Also, when you get to the survey, there's a place where you can write in a question or a thought or elevate a need. No one has a 360 on all of this, and we all have different slices and vantage points that we can offer. I'm sorry, I wanted, you said we'll throw in the survey, so I figured that would be a good time.
That's perfect. That's perfect. The survey is important. Let us know what you thought about the presentation, whether some things that we talked about that you wanted to further detail, with some other things we didn't talk about that you wanted us to touch on. We welcome you to provide your feedback to us so we can continue developing this training and making it optimal for everyone who participates.
Yeah, absolutely.
Valerie, I see you have a question.
Yeah, I just wanted to add, I wrote in the chat the Northwell health person. They have done some wonderful activities and webinars. Their program through Katz Institute is Bridging Communities of Faith and Health. Okay. And they've done mental health stuff. They've done anxiety. They've done some of everything. They have had some wonderful speakers, and they're free of charge. If you reach out to the young lady I put in the chat, Kaylani, and just let her know what you want, she will be happy to help schedule something.
Yeah, that's great. The more information you can get into your congregation, that's fine. But I want you to be able to call someone down the street to say, listen, I have someone in my office right now. I want them to come and see a provider down the block. Right.
If I can just interject on that note, Martine, I do want to share, we're talking about finding local resources. We are going to enable you to do that more easily. We'll share a resource guide with you either today or tomorrow in a follow-up email. Yes. So I just we're talking a lot about finding resources. We understand that it can be hard to do so, and we'll help you do that.
Good. So she's already did the heavy lifting, right? So all we have to do is literally pick up the phone, right? So pick up the phone and call and start to develop relationships with more than just one organization, right? Because there's some mental health clinics that are specific, for example, LGBTQ communities, right? There's some who are particular for HIV community. Find out what different resources you have in the proximity of your church to help, right? There may be some support groups for those who are caregivers, right, and need it, right? So, and then you can invite them into your church and to start having those programming and establishing that within your own congregation.
You're absolutely right, and we're beginning to land. You know, when you're on a plane, the plane should never come down all at once. It kind of starts coming down over Philadelphia if you're coming up from the south. So we're over Philadelphia now. We're getting closer to New Jersey. If you look off to your left, you could see the Jersey Shore, and we're gonna land either at JFK or LaGuardia.
LaGuardia.
So before we do come down, if there is just a sentence that you have in terms of an idea or something that your church is doing in addition to what we've just mentioned, I think it's good that we can borrow from one another. Or if a church is doing something and it's open, we may have to find the little door to the big silo where we just kind of stay in our own silo, come out that door and to share resources. I spoke to the first group about developing a proposal that really brings people together. And I know we do have Healing Dialogues and has done great work. I've been a part of their work. So keep your idea machine going. If you gotta think out of the box, you gotta also get out of the box. We've heard unprecedented. How many times? It's unprecedented how many times unprecedented has been connected to the pandemic. But I tell leaders, unprecedented events call for unprecedented actions. And just the fact that we're in this modality, this is coming out of a need and out of a resource. It's not perfect, but it's better than nothing. And there are things that I believe that we can do, and I'm glad to hear, yes, asking for help. Bernadine is absolutely right. In some ways, trauma has been normalized in a sense that you almost expect, oh, here we go again. We start catastrophizing and going through all of the shifts and the swings. We are here for each other. And I want to thank you. I want to thank you. Is there, from our facilitators, any
Well,
closing thoughts?
Diana just posted a question about how do we help people who sort of deny that they're grieving. Is that correct?
Denial, yeah, that they're.
Yeah, I mean, I think people get help when they're ready. Not everybody is ready, right? But I think sometimes you can say, this is what I'm seeing. You know, you say you're okay, but I see this and I see that. And I think sometimes it's good to just, sorry?
No, it's okay.
No, that sometimes
Keep
it's
going.
good to just talk to somebody, to like talk about what you're feeling, that it can be helpful. And even if you're planting that idea in somebody's head, maybe they think about it and a few weeks later they say like, yeah, where would I go? Give me a name.
Yeah, that's absolutely correct. Offering them, say, hey, I see this in you, but you may not, be ready, that's fine. But I know some resources, some good resources that's connected to the church, right? That the church has relationship with, that if you need somebody to talk to and you don't want to talk to someone here, then we know someone down the street. We know someone close to your house, right? That is connected to the church, right? To gain that support, because denial is part of the process, right? When we talked about this journey, denial is part of the process, and the person may not be ready at that time. But again, in this process and on this journey, they may come to another point where they say, wait a minute, maybe, that bargaining stage is about, oh, okay, well, maybe I do need to find some help. Maybe this is more challenging for me than I anticipated, right? And if they come to you, right, you already have these resources available, right? Because you've developed these relationships beforehand and can help support them.
I also wanted to thank Dina for sharing her story. And that's very, very painful. And I mean, I think if the church that you belong to wasn't helpful and wasn't supportive, that it's great. And it's a good example. You found a church that was more responsive to your needs. I think that's
right. And well, she found her way here too. And
yeah,
I think that's a miracle in itself. One thing, and Sophie's going to, would want me to say that there is a host of resources that's coming your way, and they will be available to you at the click of your mouse or whatever, your enter button, and that you can deal with that. Arsalan, thank you. And the reality of grief. Grief does not know how to shrink. Some people, it's been this long and I still feel this and that. Grief does not shrink, but people do grow. And when we become big enough, and believe me, I'm talking from the vantage point of my sister who lost her 19-year-old son at Morehouse at college in a car accident in the 1990s. In fact, Dr. Butts came and spoke came and spoke. Anger, wanting to fight. I'm talking about me now.
Yeah.
Wanting to figure out, like, you know, I just was ordained around that time, and I'm saying, like, I felt like a phony in a robe. That this happened to a boy whose grandmother and grandfather were both in the clergy, were both pastors. You know, how could you let this happen? All of these things. It is such a dynamic period where things are coming at a person from all different parts. And yes, you can sit and try to help, but you have to meet people where they are.
Right.
And that anger stage, if they're angry, if they're dealing with, or if they're not ready to deal, we gotta help them grow to be bigger than anger, than whatever stage that they may find themselves in. And there is no one way to do this thing. There is no prescription. There is no breadcrumb. There are no breadcrumbs. It's got to find your way.
Well, if there are breadcrumbs, they've all been eaten, so we can't find them.
Carol, I love you, girl. I love you.
Yes, I think a good thing too. I think a good thing too is that churches should have a day of remembrance, right? For those who have lost loved ones throughout the year, right? Acknowledging and honoring those who passed on. Right. And allowing them a space to grieve, and again, normalizing grief, normalizing that a loved one is gone, right? And we're living life without them, but they're still missed. They're still honored, right? And then, you know, thinking about ways to incorporate this into your own church lives, right? And normalizing that grief is a process, right? So it's just another suggestion for you to take back and, you know, talk to your leadership about ways, and again, destigmatizing mental health, destigmatizing depression. Right now, we're in a season where fall is here. We're walking on the heels of winter. The sun is going down by 5, 6 o'clock, right? And this period of darkness happens, right? What we call in the clinical world seasonal affective disorder, because for no reason, some people just without the sunlight begin to feel down and depressed, right? And talking about that again from the pulpit, normalizing it to let them know that it happens. It's a clinical diagnosis, right? Talking about it, normalizing it, and asking them, you know, for spaces to get help. With a simple light bulb, people feel different. Right? And if you have that information and moving forward, right, it can really bring peace to you, right? And that's what we're looking for. Church is a place of peace, right? So just more information. I know we ran out of time.
We have to stop, yeah.
And it was just a great conversation. Again, I'm going to remind you, the surveys in the chat, please take the time to, it's really quick 5, 6 questions. We would like your feedback about our presentation today. I want to thank you for spending this last 2 hours with us.
Thank you.
We really appreciate all of your input. And again, Sister Hardy, thank you for coming from Atlanta. I'm glad you found us. I hope this is just a first step for you in your healing journey and in your process. Again, you could reach out to us if you need some support. We do offer telehealth services, or we can have telephone numbers or resources in your local area. So thank you for joining us.
Thank you,
you.
everybody.
And thank you. And also, this link will be available. Arsalan, is that true? Can you say a word on that?
Yes, absolutely. So we're going to be sharing this with you all as well. And in the more short term, we'll be sending out an email, as Sophie mentioned, most likely either end of day today or early tomorrow, with additional resources, some pages you can look through on our webpage, as well as a resource guide specifically on bereavement.
Okay, well, that sounds like we have taken care of as much as we could in 2 hours. I want to thank you, Dina. if you hit me with your email, I'll make sure